Welcome back. Earlier we told you in the show the amount of people getting tested is causing some strain on our healthcare systems. Joining us tonight is Nikki Gilmore, Senior Director for Ambulatory Nursing at the University of Utah Health. Nikki, thank you for joining us on a Friday night.
Yeah, you're welcome. Happy to be here.
Yeah, Nikki, I wanted to know, what type of wait were people experiencing prior to the switch to appointment-based testing?
Yeah, we've seen over the past couple weeks volumes of people testing increase dramatically. And so, over the past couple of weeks, we had wait times in excess of 2 to 3 hours.
And I'm guessing that's what led to your guys' decision to move to appointment-based testing only. What kind of advantages does that serve not only to you guys, but to patients themselves?
Yeah, having such long waits really, put undue stress, frustration, hardships, not only on our patients, but on our staff as well. So this is going to allow us to actually manage that a little bit better and be a little more efficient and orderly about the way we do it. We're still planning on testing, the same amount of patients, but can just be more organized about the way we do it and avoid those long and extended wait times.
U of U Health also now offers the less invasive saliva testing. So talk about the difference between that test and the swab-based test. Are you guys seeing more people opt for the saliva test?
Yeah, definitely. And we wondered if that was some of what led to increased, testing as well, because we were one of the first to go live with saliva testing. So yes, it's much less invasive. A lot of people had such a fear of that nasopharyngeal swab that, tickles your brain almost. And so this is much less invasive and found to be just as accurate. We've been very fortunate to be able to partner with our laboratory partners of ARUP and find that it's just as accurate of a test and much less invasive and more comfortable for our patients to be able to obtain.
So are you guys seeing more people opt for that saliva testing as a result of that?
Most definitely. I don't know of one patient that has chosen to have their brain tickled instead of saliva, to my knowledge, yet.
What's the turnaround time right now to get results for testing? And you were talking about these tests are really accurate. Do you have like a percentage of accuracy?
That's a hard number. I know it's very, very high 90s. I'm probably not the content expert, but I know from talking to the physician leaders of ARUP that it is known to be just as accurate as the NP swabs that we have been doing. Our current turnaround times are on average of about 48 hours. So very happy that they have been able to continue to keep up and have some pretty good turnaround times for these tests for our patients, despite the increased volumes.
Now, I know one of the things we were talking about is workload, right? Burnout, fatigue. Tell me about our healthcare workers, those not just in the hospitals, but at your guys' testing sites. What does it look like if in the hospital rooms, and as our positive case counts continue to rise, what are you guys experiencing on that mental and physical, emotional health?
We have an amazing, dedicated workforce. All of our healthcare workers, are so committed to our patients. And so they're willing to work those long increased hours. And so I think they are tired. They are just having all of the same stress and hardship in their personal lives as well that everyone else is going through, along with the added stress at work. I'm very proud of the organization that we work for that has done so many innovative things to be able to support our staff. We have a resiliency center. We're looking into innovative ways to have flexible schedules, help with childcare, be supportive of those working parents as children go back to school, and our home, having to do school from home or have a hybrid model. So being just as supportive as we can to try and reduce any burden, whether it's personal or workplace, to really be supportive of them and help them through this.
All right, about 90 seconds left. What are you guys seeing at the U of U Health, and what are some of the transmission rates or trends among the people being infected?
Yeah, so just like the rest of Utah, we have seen about a 100% increase in testing over the past couple of weeks, and we're really seeing, the highest percentage increase in that 15 to 24-year-old age range. It's actually been a 230% increase since the end of August. Also seeing an increase in the 25 to 44-year-olds, about 113% increase, and a little bit higher in the kind of 45 to 65-year-olds as well.
All right, about a minute left. What should people know before they look to get tested? We know they need to get an appointment beforehand, but do they need a doctor's note? Do they need to show certain symptoms? Tell us what we need to know if we're looking to get a COVID-19 test.
Yeah, so a doctor's note is not needed. We're trying to make it as convenient as possible. And so they are able to schedule an appointment through our patient portal, which is MyChart, or just online, even if they aren't a previous patient of ours. And we have a lot of questions in there about the COVID symptoms. Do they have one of those symptoms or as many of those symptoms? Fever, cough, fatigue, loss of taste or smell. I think all of us are pretty familiar with those. Or really getting into the high risk exposure, being within 6 feet for greater than 15 minutes. And then waiting that 5 to 7 days. They're really asking people, especially if they don't have symptoms after that, to wait 5 to 7 days, so that can kind of build up in your system. And that's when you're most likely to kind of test positive for that. And then also looking for, all of our school children. There's a lot of surveillance going on in the schools, and schools are monitoring things very closely. And if your child has been exposed and have a high enough risk, they're providing referrals as well to be tested. And so that's another thing that we're expecting, and are happy to get them tested.
All right, Nikki Gilmore with University of Utah Health. Thank you so much for joining us on the show. Have a good Friday evening.
Yeah, thank you.